Good morning, everyone. First of all, I'm Joe Wallowitz. I'm CEO of NeuPath Health. I've been running this business for about 3 years, but actually joined the board when we did our RTO in 2020. So I've actually been with the company for almost 5 years now, but actually operating it. And it was really kind of Q3 of 2022 that I took over. I think most of you can appreciate that the board doesn't usually step in to run a company in a good situation, so there was some challenges that we faced back in 2022, and I'm here to tell you about kind of what we're doing and how it's changed since then. Myself personally, I don't have a slide on our board, on our management team, but I've been in healthcare for almost 30 years, mostly on the pharma, on the pharma and the biotech side. So this is sort of new for me, running a clinics business. But I like to just get rid of that word first when I talk about clinics. We're really treatment facilities, and I think I'll explain that to you a little more, that these are not really clinics. They're regulated treatment facilities. So we are Canada's largest provider of chronic pain treatment, operating currently in Alberta and Ontario. I will be making forward-looking statements. And we also use non-IFRS measures to evaluate some of our metrics. So when I talk about first what we do, a lot of people think, well, private clinics, this is a private business. Well, that's actually not really true. We are a private provider of public health. So we operate this network of chronic pain treatment facilities in Canada. Essentially, it's under the public system. 98% of what we do is paid for by Alberta Health or on OHIP in Ontario. And what you get done in our clinics, in our facilities, is the same that you would get if you went to a hospital. And what's really happening here is that what we do in our facilities, 30, 40 years ago would only be done in hospital. And so as you do these things over time, you've seen as hospital systems have been, as they've been overloaded, many of these treatments that people do that don't need a hospital, are being moved out into the community. And you've seen that in all sorts of areas. You've seen that with lab testing. If you go to a lab test in Ontario, you go to MDS, you go to Life Labs, you go to one of these other facilities. You don't go to the hospital. But 30 years ago, you go to the hospital to get a cholesterol test. And so a lot of these things have been changing over time, and the government uses people like ourselves to provide a service in a community setting. This is a large growing market. Unfortunately, probably most of you in this room know somebody who's been suffering from chronic pain. Chronic pain is a very difficult thing to treat. These are, and of course you have your aging population, people being active as they get older and older. So there's all these factors that have played into this, the market, expanding the way it has. We have lots of opportunities for growth, organic and inorganic. I said we're largest in Canada. I don't even cover all of Ontario yet. In Alberta, I'm in Red Deer and Edmonton. So even in the two markets in Canada I'm still not fully saturating that market. So we feel there's a lot of opportunity, here in BC, in Calgary, Quebec. There's other provinces that we're looking at across the country. I mentioned briefly regulated medical facilities and specialized equipment. So just to be clear, when we build a new facility, we're probably $200 to $300 a square foot. If you look at a normal, a medical clinic is basically, 4 walls and a doctor, right? What we're doing is it's really more capital intensive and more specialized in terms of the quality of what we're providing there. For example, the air quality, the infection control procedures. We put lead in the walls to be able to operate fluoroscopy machines. So there's things that happen in a treatment facility like we have that's not, that you wouldn't get in a normal medical clinic. What I'd also like to add is just kind of the whole idea of, this. I mentioned the health policy piece here, but these specialized equipment pieces, these are rather, they're expensive to put in place. You got to get approval from all the regulators. So in Alberta, the Alberta College of Physicians will regulate there. In Ontario, the Ontario College of Physicians will regulate our facilities, and we get inspected regularly. They come in, they do chart audits, they look at all the procedures, equipment, et cetera, that we do there. I think this whole concept of doing things out of hospital that don't need to be done in a hospital is growing. I mean, you're hearing governments talking about minor surgeries. How do we do minor surgeries out of a hospital setting? And then, finally looking at the business, and I apologize, my voice is a little off today. The turnaround has happened. So when I took over in 2022, the business was cash flow negative. We've turned this around. Our balance sheet was a mess. And so now we're really in a great place to both use our cash flows and our better access to debt capital right now to kind of help accelerate our growth and address some of these markets that we're not yet in. And like the team here, we've been running this business for a long time. We know what we're doing, and we're just getting better at it. So let me talk a little bit about where we are, so you can kind of see it visually. In Ontario, we're from Ottawa to Windsor, and kind of everywhere in the middle. In Alberta, we're in Edmonton and Red Deer. Red Deer is an interesting one because that was our first partnership where we built a new facility in partnership with a new orthopedics business. So Central Alberta Orthopedics is a large practice of orthopedic surgeons. They wanted to be able to provide chronic pain services to their patients. So together, we built this new facility. So there's a sports medicine clinic, there's surgeons, and there's interventional pain medicine below. Maybe I'll spend a second just to explain to you just one thing, because some of you think of chronic pain, there's probably a lot of you are going, opioids? And just to be clear, there are no opioids. We don't do opioids. Interventional pain medicine is a very different procedure, and I'll talk about that on another slide. We also operate under a number of different brands, as you can see here. From a customer point of view, really, referring physicians are sending people to us when we change a brand name. Doctors have a very, apologies for their name in the room here, have a short attention span. So if you change your name, they think you closed. So you really don't, the benefits of branding are not really there because we're not a commercial business, a consumer business, I should say. I have 1,200 patient wait lists in Ottawa right now. I'm getting 50 referrals a week. We can only get through 30. Edmonton, massive backlog. I have over 18-month wait list depending on the procedure you're waiting for. So like the public system, we also have that same problem. So I don't have a customer problem. It's all about getting efficient, getting more physicians in the clinics, and be able to treat more people. So I talked a little bit about the turnaround in the business. So I wanted to show this here. I did, because we just reported in August, and really looking at the first half of this year because it's an important baseline because I took over in Q3 of 2022 and just kind of look at how the business has grown. This is all organic. We've had 11% CAGR over the last few years. You can see the growth is accelerating. We're tracking towards over 80 million. When I took over, we were about 67 million business. But the EBITDA, you can see when I took over in 2022, we finished that year with about 1.6, 1.7. As you can see, first 6 months of this year, we're tracking much higher than that. And I just want to add a caveat that I've been putting out to all investors. We did have a special one-time item. So if you look at our press releases, you look at our disclosures, you'll see that we said in May, we're going to get a one-time item in Q2. We got that one in Q2. So that helped juice the numbers. We haven't disclosed the exact number, but basically you can assume our margins, when we started out, we were probably 3%. We're now 7 to 8-ish, excluding these one-time items. But also from cash flow perspective, right? Like, we talk about adjusted EBITDA here, and I know that people go, well, wait a second, that's not cash flow, and you're right. And especially for a facilities business, we look at internally as well kind of EBITDAR, which is about closer to a free cash flow number for us. And when I took over, it was negative, and now we're tracking very well for this year. When you look at, and if you look at our disclosures, you'll see there's the IFRS, some of that we capitalize, some of that gets dumped into operating expenses. We consider both of those an expense. I rent a facility. IFRS tells us not to. So it's kind of one of those wonky things, but everything's in our disclosures, and you can see all that. So the biggest problem I had when I came on, aside from the margins, was the actual balance sheet was a mess, right? So we had $1.5 million in cash, $6.8 million in debt. So our net debt was $5.3 million, and we were cash flow negative. Well, turn that around to today, we had almost $4 million in cash as of Q2. And our net debt is now dropped to 2.7. And if you look at our first 6 months of this year, we had $3.5 million adjusted EBITDA. So we're not, the balance sheet, I say 100% turnaround. We've done great in kind of fixing that piece. And the next step is to continue to improve those margins, right? So, and talking about how we grow this business, well, there's really 3 ways. We increase capacity at our existing facilities, our capacity utilization. And so you see always in our reporting, we talk about, capacity utilization and how well we're using our space. Expanding our network. So we expanded to Red Deer. That was a new build. Expanding our facilities. Brampton right now is expanding. Windsor is expanding. So as we expand our network, and then finally adjacent markets. I have so much work to do here on the two left. I don't talk much about that, but some of my facilities have what we call a fluoroscopy suite. I mentioned that earlier. I think a fluoroscopy is just a fancy word for real-time X-ray.
Why would you do that? Well, if a doctor's sticking a needle in your spine, you'd like him to know exactly where it is, and that's really what it is about, is that the real-time X-ray will let you know where that needle sits in proximity to all the structures in your spinal structures. So when we do fluoroscopy, that looks a lot, those rooms look a lot like surgical suites. And so if I ever got all the way down to the other end and start thinking about other things, orthopedics is definitely an area that would be a great adjacent, you're a candidate for surgery. No, yes, no, well maybe we'll send you over to the pain side. Your pain treatment isn't working, maybe you're a candidate for surgery. There's an obvious fit there, and then of course all those patients need radiology. So we're definitely thinking about some other pieces, but here, definitely done a great job on this side. We're doing all this, we've added new services. I'll talk about one that we've added recently. We add some private pay procedures. Basically, if the government pays for it, I can't charge you, but if there's things the government doesn't want to pay for, we're more than happy to make that available. And so that's what I mean there. Second, this whole, we are looking outside of our existing network to add to new sites, and we have lots of things going on in Ontario and Alberta and in BC that we're looking at. So we're looking at new locations for expansion, and then, as I mentioned there. So that's kind of been the execution. So let me talk a bit about these treatment facilities. So I did mention a little bit about, spinal procedures. So things that we would do, for example, patients with chronic pain could benefit by a ketamine infusion, for example. Not the dose for chronic pain is different than the field trips, but they can get ketamine infusions or lidocaine infusions. They can get Botox for migraine, for chronic migraine. They can get what we call spinal RFA, what they call where they actually burn the nerve endings of your nerve endings around the spine, which allows you to move around and have better mobility. We do nerve blocks, we do all sorts of different procedures, and so that's why when you hear all that, you realize why these are regulated, because the big thing that the regulators are worried about is infection control, right? That's probably the biggest one that we do in our facilities. So when we're trying to bring on new doctors, they're like, these are regulated facilities. So yes, a doctor can go out and go to Royal Bank and get a couple $1 million because banks love to lend to doctors. Yes, the doctor can go buy, $150,000 fluoroscopy machine. Yes, he can go hire some radiation techs. But it's the combination of all these things that come together and create a great package for physicians. So you get the great facilities, you get the new technologies. Referral network. So in Alberta, U of A, their residents rotate through our facility, because when you look at that facility right there, that's Health Point, it looks a lot like you'd see in a small hospital. Like it's got a really nice feel and look for doctors. So they're going, hey, wait, I can work in a hospital-like setting without hospital-like bureaucracy, hospital-like traffic and parking downtown, and all the other things that become a problem for physicians. So you put that all together, those physicians rotate through. Instead of spending 18 to 24 months building up their patient list, they walk right into my clinic, and I've got an 18-month wait list, right? They can just immediately build up their practice, right? So, and then of course all the other stuff that any other operator would do, IT, et cetera. Like those are kind of things that, you put that all together, and I think it's a compelling vision. And remember that these doctors are paying me, they're paying us a portion of their billings to manage this for them. If they went to a hospital, the hospital eats that cost. So a doctor's actually saying, wait a second, I can work in the hospital and pay no overhead, or I can work at your facility, and they're gladly doing it. And that should probably tell you a little bit about what it's like to work in a hospital. I think one of the things that we spent a lot of time, I mentioned earlier about our footprint and right-sizing the business. When I took over, one of the challenges we had and being cash flow negative was that we had about 93,000 square feet. We now have 68,000. And as you can see, my revenues have gone up through all that. So it's really been this whole, we had a lot of excess capacity that was, it would be a long story, which we can talk over at our tables if you come and see me. But we had a lot of excess capacity that was just empty space. And so we've really cleaned up our real estate portfolio. So cleaned up our balance sheet, cleaned up our real estate portfolio, growing the business. And the combination of all those are creating that tailwind that we've had. So we expect to be here, and you can see that capacity utilization is growing. So I talked about, a little bit about, expanding outside of kind of the government pay markets, and what we look for there is things that could be, that people are excited about, want to have, treatments they'd like to get, And this is a new one. So we were the first person to launch this product, operation to launch this in North America. It's not yet approved in the US. It got approved by Health Canada last year. And it's a thing called Arthrosamid. Arthrosamid, of course, our healthcare providers are not yet paying for this, so we're allowed to charge patients for this. And it's a novel treatment option for osteoarthritis of the knee. What it is it's an implantable, it's an injection that creates an implantable in your knee that creates kind of almost a shock absorber, a cushion in there. It's a pretty cool product, and we've had now, I think we said last time we did about 75 procedures already. This is about 4,200 per person for a procedure, per joint. And the outcomes have been phenomenal. You know, we've been already, it's one thing to be able to charge that and have people come and do that, but actually have patients call back and say thank you, right? Like this is, it's been amazing. And so we've already had a number of our employees have their relatives coming in. It's all word of mouth right now, and it's amazing. But also a lot of Americans have been coming up. So I'd say about more than half of the inquiries and up to a half of our procedures have been people coming up from the US to get the procedure done because it's not available there yet. So they used to fly to Europe to get it. Now they're coming to Canada. There's about 7,000 procedures done already in Europe. Canada, we're the first, and we're about 50% of the volume right now in Canada. If you Google Arthrosamid in Canada, you probably see us first. The inorganic growth piece. Well, I think the challenge has been that I think I heard the last presenter talk about the cost of capital, and certainly I'll talk about that in a second, is that our cost of equity is too high, right? I can't walk into a doctor's office and say, let me buy your operation for the price of my stock, for the price of our multiple. So that's been a challenge. So we've been focused really on improving cash flows and getting better bank facilities in. So we just announced in March that we have a brand new $6.5 million debt facility with National Bank Financial. We have an acquisition line, a credit line, and term debt. And so the combination of those three at prime plus, then that's an inexpensive way for us to kind of lever some really smaller operations and put them into what we're doing. So we have a nice list of things that we're working on there. Improve facilities in our core markets. So we're looking for things that upping our technology game, and so expanding into more specialized procedures. New markets where we're not, I'm not in Northern Ontario, I'm not in Calgary, those are kind of, but also new provinces. And then finally, the new treatments I mentioned, there's some other things we're evaluating right now in addition to Arthrosamid. And then finally, the adjacent verticals, so things like surgery, radiology, et cetera. So there's a lot of things that we can build on to add to this piece, and I think that having a more comprehensive care solution would be an ultimate goal here, and being able to take that patient, get the image, refer them for surgery, refer them for interventional pain, and have that ecosystem kind of flourish amongst itself. So that's the longer term piece. So from we have a really tight capital structure. It's very interesting. So we have about Bloom Burton is a Toronto-based investment bank. They're about 30% of our company. Claret Investment Management Montreal is about 12% of the company. And then we have probably 5 brokers. And I'm trying to see who's here. I could probably make about 5 more phone calls. We're about 80% of the company, right? So management's been buying. My president, Stephen, who's here today, has been buying. I've been buying. And the NCIB's been buying. And it's because, if you do our market cap at 16.9, I said I had 2.7 million in net debt. Versus our EBITDA for the trailing 12 months, you're seeing that we believe that it's undervalued, and we have the cash flows to support this. So we've been doing that. We started the NCIB last November, and it's not aggressive, given the company's been had some financial challenges 3 years ago. We didn't want to be too aggressive on it, but we're definitely trying to send the message that if I want to buy a doctor clinic at 4 times, it's not going to happen. So we think it's a good use of capital for now. So looking out to the next 12 months, I think we think we'll see continued high single, low double-digit growth for the base business. That's been we just added this new procedure now, Arthrosamid, that's also starting to pick up. Our adjusted EBITDA margin is continuing to improve, so we expect this year to have better than last year and better than the year before. I've always told investors the goal here would be about on our current footprint, being a public company with
80 million revenue, there's a certain amount of overhead that's just being a public company. We can probably get to about 8 to 10% margins on our existing business, and then as I take this business and grow it and expand it, so take it from 80 to 150 to 200, that potential changes, right? So we're at 8 to 10. We probably year to date for 6 months we were almost there. So we're focusing a lot now on the underlying operations piece, and I think I'm really pleased with how the team's been doing, not just in evaluating new growth opportunities, but also just fixing some of the operations that were not performing as well as they could have. And then inorganic, I mentioned our new credit facility. We added Stephen. One of the reasons I hired a president to work with me is because of all his experience on the integration of one of the last clinics we bought, and being able to kind of look at some new opportunities. I think it's just added some bandwidth for me, as well as an ability to kind of preconceive all the integration pieces that we need to deal with. So that's it for now.